this timely and important conversation. So Dr. Fies and the entire team, just appreciate what you do day in and day out here at the hospital. We're also joined by Veronica Del Rosa, Executive Vice President at San Isidro Health, who we'll hear from in a little while. Now, while the main purpose of today's conversation is to highlight the impacts of cuts to healthcare and Medicaid specifically. We know that there's a movement afoot, significant efforts in Washington, D.C., at the nation's capital, to impose significant cuts. Not to over-politicize the situation, but just to be real and factual, it's clear that the efforts by President Trump and Republicans to cut so significantly in areas like Medicaid would simply be to fund tax breaks for the most wealthy in the country. I'm against that. And so they need to know what real-world impacts would be of these plans. It's not just a dollar figure, it's not just a percentage, it's not just a statistic when it comes to Medicaid. It's family, it's children. Half of the children in the state of California count on Medicaid to access health care. So that would be a huge, devastating hit to the state of California, but more importantly, to kids and families in California. That's what we're here to highlight. So I'm actually looking forward to meeting some of the kids and hearing some of the stories. I already see a future firefighter blessing us with his presence. And I do want to take a moment just to say that it's important to me, not just as your senator, but as a father. My wife Angela and I, we say we're not trying to raise three boys, we're trying to raise three gentlemen. Right? They're age 17, 12, and 10. My baby's now 10 years old. And while thankfully we haven't had to lean on a children's hospital for a long-term illness or condition, I know what the feeling is like just having to rush to urgent care or the emergency room when something's going on, you don't know what it is. When a family or a parent is in that mode, you just need to worry about access to care for your child. You should not have to worry about how am I going to pay for it. That's just wrong. So again, a big thank you to Rady's and the entire team for making the experience possible for the parents who come here to be able to focus on their kids' health and recovery and not on the cost. And we're going to go down fighting if we have to make sure that we're there with you so that parents don't have to worry about cost of caring for their children. So thank you again for having us, and turn it over to my colleague, my friend, Sarah Jacobs, your member of the House of Representatives.